Hi, Michaela Lafrac here. The podcast you are about to listen to has been edited for clarity and brevity. This is Vermont Edition. I'm Michaela Lafrac. In 2024, it's estimated that more than 630 Vermonters will be diagnosed with breast cancer, according to the nonprofit Susan G. Komen. One of the best ways to improve breast cancer outcomes is to detect it early, often through a mammogram. As the old proverb goes, an ounce of prevention is worth a pound of cure. But what if getting that preventative care is intimidating? What if visiting a provider is a stressful experience or an expensive one? Today on the show, we're going to discuss the importance of breast cancer screenings with Dr. Jacqueline Burrell, a primary care physician with Avalon Natural Medicine in Burlington. We'll also learn about a program through the Vermont Department of Health that lowers the cost of some health screenings. But first, Vermont Public's Morning Edition host Jenn Jarecki recently signed up for her very first mammogram. She didn't know much about the process going into it, and that made her think, well, maybe there are other people who don't know much about it either. So she decided to bring a Vermont Public colleague and an audio recorder to her appointment to document the process. After we play her story, Jenn will join us to answer some questions, and we will open up the phone lines. But first, here's Jenn Jarecki.
Last year, I had the chance to do something I'd only ever heard about, a lot about, but had never experienced myself.
You're gonna start to feel it pull on your chest wall, which is completely normal. We're gonna stop there. Jenn, hold your breath.
That's me getting my very first mammogram. A lot of people find mammograms intimidating and awkward, physically, or even to talk about in the first place. Like, here's my mom Deb's poetic way of describing them.
It's uncomfortable. It's like somebody puts you on a cement garage floor and backs a car over you.
And healthcare organizations offer so much varying guidance about mammography, which can make it hard to figure out if someone should start getting screened and when. Providers say that's a problem because mammograms are an essential tool to catch breast cancer before it advances too far to treat. So I'm sharing the experience of my first mammogram in the hope of demystifying this procedure for anyone considering a breast cancer screening. And as a heads up, I'm using the term breast in this story, but chest health is also common since people of all genders are at risk for breast cancer.
How are you feeling? I woke up pretty anxious.
It was an almost hot September day when I drove to Porter Medical Center in Middlebury with Vermont Public reporter Elodie Reed, who was there to both document the procedure and provide support in the face of my mounting nerves.
So much of it was thinking about having that more host head on. And then I woke up this morning oh, but you're the human being getting a mammogram today. These are your breasts and this is your breast tissue and it's actually happening.
Clearly, this was no regular doctor's visit. But let's rewind for a hot second, because those nerves definitely preceded my appointment. My mother always told me, you turn 40, you start getting routine mammograms. But when 40 came around, I wasn't quite sure. And here's partly why. 15 years ago, a major national group that influences doctors and insurance coverage changed course to recommend no longer starting routine screenings at age 40, but at 50 instead. Meanwhile, there's an alphabet soup of acronymed healthcare organizations with their own mammogram guidance. So I thought, better ask my primary care doc, Catherine Naden, what she thinks.
How worried are you that you might have breast cancer? How much do you want to open Pandora's box? Sometimes people have less anxiety keeping Pandora's box closed, and sometimes they have more anxiety knowing that they're choosing not to open it.
And I felt like keeping that box closed wasn't an option, so I requested a screening. Breast cancer is fairly common in middle age. Dr. Naden says it can occur earlier in life than many other cancers.
You don't expect to get cancer at 40. It's the first time for most people that they have to face their mortality, that they might actually get a cancer diagnosis out of this test.
And if there's one thing I consistently heard from Dr. Naden and pretty much everyone else I spoke to for this story, it's this.
Breast cancer is very treatable if we can catch it early.
The more screening we do, the more cases we detect, the earlier we detect them and the more treatable they are.
Early detection is so critical.
Absolutely. Early detection is the best.
A mammogram is an X-ray of your breast tissue, and the screening, start to finish, usually takes about 10 minutes. Your very first set of images are crucial. They establish your baseline, which is what your future mammograms are compared to. And mammography is all about comparison because it helps with, you guessed it, early detection. Early detection can be paramount in finding breast cancer, particularly for aggressive cancers, which is why experts are worried that at-risk Americans are getting far fewer mammograms than they did 15 years ago when that popular guidance shifted. And according to UVM Cancer Center research from last spring, Vermont has seen the second steepest decline in screening rates of any state in the country. But knowing if you're at risk and if it's the right time for a screening can be tricky. Dr. Naden recommends talking to a provider you trust.
This is a very nuanced conversation. It's really got to be about family history, when you had your first period, how many kids you've had, and it's not something that can be boiled down to a soundbite of this is who is average risk and this is who is high risk.
But sometimes, be it the physical discomfort of the exam, the potential results, or the way someone is raised, people can be apprehensive about getting mammograms. And that brings us back to the drive to my screening with Elodie, who we met earlier. See, I heard a lot about mammograms growing up, but turns out Elodie didn't, because of the religion she grew up practicing. She says if her relatives ever got screened, she didn't know about it, even though it might have changed the course of their lives.
I'm pretty sure my grandmother died of breast cancer, but I don't actually know. And then my mom definitely had breast cancer, and I know that because I took care of her.
That got Elodie thinking about her family history and how it might impact her.
There's implications about my health as well, and I'm an only child, but I don't know if there's implications for female cousins or I don't know. I don't actually know.
Although there is a hereditary link with breast cancer, Elodie wasn't super familiar with how mammograms worked. And experts have told me that lack of knowledge is also part of the reason people aren't comfortable getting them. When you know how something works, it becomes less intimidating. But when I showed up to Porter Medical on that balmy September day, I was still a little nervous.
Here we are. So now it's one step closer to my first mammogram.
Your mother's, sisters, daughters, aunts, grandmothers, or any male relatives ever been diagnosed with breast cancer? Blood relatives only.
Now that we were seated in radiology and I was filling out paperwork, things felt pretty real. And just as I could feel my heart race even faster, in walked my mammographer.
My name is Brittany Ferdinand. I'm a radiologic technologist and mammographer, and I've been doing mammography for 9 years.
Your mammotech is wildly influential in your experience of getting screened, both physically and emotionally. But with her broad smile and infectious optimism, Brittany immediately put me at ease.
So come on in here, Jenn.
It's like a spaceship.
Yeah, right? We just keep the ambiance just really chill. So it's calming vibes. Let's start with your right breast. So if you'll just take your arm and slide it right out of the sleeve for me there, Jenn. This machine's gonna be your best friend.
Okay.
But I want you to just lean in with me as much as you can. And I'm gonna start to bring this compression down. We're gonna stop there. Jenn, hold your breath. Okay, back right out. That's one. That was not bad.
And it really wasn't that bad. Thankfully, nothing like being put on a cement garage floor and having a car run over my breast, which was a relief. But that was just one shot. And a mammogram includes multiple images of each breast. So we moved on.
I feel so funny asking people to relax their shoulder when I'm literally bringing down compression. They're easy for you to say. So basically what I'm doing right now is pulling all your breast tissue forward and making sure that I have all the anatomy that I need to prove that I have all of your breast tissue on an image.
mammo tech may show you photos there on the spot, like Brittany offered me in Elodie.
Wow, that is so wild.
Isn't it interesting?
Yes, it's fascinating. It looks like the moon.
And I've never heard anyone say the moon, and it totally does. Like the little craters.
Exactly.
Breast tissue looks like these grayish, pocketed swirls in pictures. And this tissue weakens as we age. So the younger the patient, the denser the breast tissue, and the greater the chance you may need additional imaging, since it can be harder for radiologists to see anatomy as clearly on the first pass. That's why a lot of doctors and radiologists recommend that people in the 40 to 49 age range consider getting called back for more imaging as part 2 of a 2-step screening process.
They may see something in your breast tissue that kind of raises a little like, oh, we need to check on that just to make sure it's not something that they should be monitoring more closely.
And Michelle Ains, the director of radiology at Porter Medical, really doesn't want the fear of a callback to stop you from taking that first step. Unlike my primary care doc, she recommended ripping the lid right off of Pandora's box.
Because not knowing, it's not going to go away. The disease is still going to progress.
In addition to supporting breast cancer patients for nearly 2 decades, Michelle is a survivor. So I asked what role mammography played in her diagnosis.
The ultimate role. My cancer was so small, I would have never felt it. If it had not been for the mammogram, mine wouldn't have been found perhaps until it was, too late.
Gradually, as I talked with Michelle, she revealed her own experiences as both a healthcare provider and a patient.
There's times during October Breast Cancer Awareness Month that as a patient who had breast cancer, I don't want to be reminded everywhere I go about it. I'm reminded every day.
Still, Michelle says there's power in sharing your story and raising awareness and community for others.
I'm so thankful at the same time that the word is out there. Breast cancer doesn't define you. It's part of you, but it doesn't define you. And don't hog your journey. It's not just for you.
And I felt similarly, at least when it comes to screenings. If just one person feels a little more ready to get their first mammogram after hearing about mine, I'm grateful to make a very personal experience public.
The boob squishing is over.
The boob squishing is over.
I definitely felt relieved as Elodie and I got into the car after the screening, but I wondered.
How was it for you to witness, but also you and your relationship with
Breast cancer?
Yeah.
It's funny. I grew up not wanting to know about things because my religion told me that wasn't useful to developing my spirituality. And then turns out I'm actually a super curious person and I love knowledge. And I love that I know how that works now.
Yeah, me too. And I'm relieved to share that I received my results the very next day. They have my baseline and didn't find anything that needed more imaging. So now I just wait for my next annual screening.
Well, now I'm just going to call you every year and be like, Elodie, I'm getting a mammogram.
You can come for mine.
Exactly. You're like, hey, it's the thing we do.
Yeah.
We go to each other's mammograms.
Marissa Herrera, Dan.
I'm Michaela Lefrak, and that was my colleague, Jenn Jarecki. Jenn joins me in the studio now. Welcome.
Thanks so much for having me, Michaela.
What a treat. Well, listeners, you can join the conversation. What are your thoughts on listening to Jenn's story? You can give us a call at 800-639-2211 or send an email to vermontedition@vermontpublic.org. Jenn, such a delightful medical romp. I never thought I would have so much fun learning about a mammogram. But you also described some real anxiety that you were feeling going into this appointment. I wonder if you could tell us a little bit more about where those feelings were come from.
I think part of it was, as I said, just not knowing much about it. I was blessed to have a mom who was featured in the piece who talked to me a lot about getting mammograms, about why you get them. But the process itself was opaque. And so I think there was some anxiety there. And then, honestly, because it's a cancer screening. And I think just signing up for that and signing up for year after year after year of that, I had some feels. It didn't feel like a romp at first.
Yeah, I bet. Well, it also, I'm sure, felt in many ways like a very private experience, but one that you decided very generously to share with our listeners on air. Why did you decide to make this appointment more public?
A question I have asked myself a number of times. And then I think we landed on it in the end there, was that if this were come to pass and we were able to bring something like this to the air, if even a single person was like, okay, well, now I have a better idea of how mammograms work, that's less opaque for me, maybe I'll go get one. And that felt like enough, given the stakes. And I think not too far in the back of my mind had been an interview I had done in April of last year with a researcher at the UVM Cancer Center about the decline in screening rates. So these things just seem to be, my turning 40 and needing a mammogram coming up against, this research that folks were getting far fewer of them. So it felt a little scary. But I thought, if the editors don't want to do it, they can say no, and they didn't. Yeah. So we got to make a you're right, private experience pretty public.
Yeah. And I'm also wondering about some of the barriers that you discussed in this story. And we're going to be talking more about those barriers with a medical provider in just a few moments. But first, let's talk insurance and cost and all of that. Can you tell us a little bit about what your experience was like with having not just the access to the doctors that you needed, but being able to cover costs and what you learned during the reporting about how that might be more difficult for other folks? Totally.
I'm really privileged to not only have health insurance, but to also have a regular primary care doctor here in Vermont, having been here for a number of years. The process was really easy for me. And in reporting this story, it became really clear that that is not the case for a number of people. So when I was in the appointment with Dr. Naden initially, without the microphones, and asked her to call one in, I got a phone call from Porter while I was still in that appointment, asking me to set up my mammogram. And so, which was then done for not too many months in the future. Even it could have been a number of weeks. I don't remember exactly how long it took from the phone call to setting up the appointment, but I remember thinking, wow, that's pretty quick, particularly because I had heard anecdotally after that interview I did with the researcher over at UVM that, that folks had been months and months and months waiting for an appointment. Very difficult. Yeah. So I do hear that's an issue. It wasn't for me individually.
We also received an email ahead of today's show, but after your story initially aired on Morning Edition, from a listener named Christina in South Burlington, who notes that, as you said in your story, Jen, that there's been a drop in the number of Vermonters getting regular breast cancer screenings, according to this recent UVM study. And Christina writes, the issue may be in part due to access to timely mammograms at UVM Medical Center. With a history of breast cancer in first-degree relatives, I am diligent about annual screenings. My 2023 mammogram was in February. Unfortunately, the soonest UVM was able to schedule my 2024 one was July. That means that my screenings are spaced longer than once per year. Over 30 years at this rate, I will have 10 fewer screenings than I should, simply due to scheduling access issues. Jen, I'm curious if scheduling was scheduling difficulties like the one that Christina mentioned was part of your experience or came up in your reporting?
It did in an interesting way. So it had taken us a little while to set up the exact appointment only insofar as we wanted to be sure that the radiologist would have extra time, our radiologic technologist would have extra time to talk us through the process, and she was doing that for a microphone. So we set it up, and then I got an automated phone call from Porter saying they changed my appointment to another day and time altogether. And I called back to say, hey, just got this note, thought we'd set everything up. I'm with Vermont Public. And they had some staffing issues. And even Brittany Ferdinand, who's in the piece, has since moved out of Vermont and is not working at Porter anymore. And so we were able to keep the original appointment, but on account of not having enough techs in the building, they were going to need to rearrange things. So yes, I think staffing across the board is an issue. And in particular, in Vermont's most populous county, in Chittenden County, I'm not surprised to hear that's all more of an issue.
Sure. Yeah, an issue we hear in many different parts of the medical sector as well.
It didn't even occur to me to try to get an appointment in Chittenden County. Actually, I live in Addison County, and I had a feeling I would get an appointment there quicker, and that ended up very much being the case.
Yeah. Well, let's take a call here. We have a call coming in from Burlington from a listener named Kashka. You're on the air. Go ahead.
Hi, how are you? I love you guys. You know this. This is Kashka from Burlington, and I just wanted to say I got in my car, turned it on, and I heard Jenn say, you know, I'm a curious person, and I love knowledge, and I don't know why I haven't done this before, or, you know, why I wouldn't do this, or I wouldn't want to do this. And I haven't gotten a mammogram, and I have to say, it just made me think, wait a minute, I'm a really curious person. I love knowledge. I do all this research, and I just have been putting it off for like 9 years now, and I'm going to do it. So it just completely resonated with me. It's so true. Like, well, why not? I do love knowledge. I am a curious person. I'm just going to go. So thanks. I really appreciate this.
Oh, well, thank you so much for calling in. Jenn, what's it feel like?
Well,
to
it's
hear that call?
radio, so I should just express I have a, ear to ear grin in hearing that, I truly meant what I said in that if even one person hears it and decides I'm going to get a mammogram, I'm really floored. That's a little foot lamp, as they say. That's awesome. And I hope you have a smooth experience in getting one. And I hope that it's something you're able to do in the not too distant future.
Well, Jenn Jarecki, thank you so much for your reporting and for coming on to talk about it with us. We so appreciate it.
Thank you so much to Vermont Edition for having me and giving us the space to have a much fuller conversation about mammograms, which is such a, like my breast tissue, dense topic.
There's the Jenn Jarecki humor we know and love. Well, much more to come. And if you want to see some photos of Jenn's experience, you can go to vermontpublic.org. They're captured by Elodie Reed. Really beautiful images there that give you a bit more of a sneak peek into what this experience might be like. Our next guest is a doctor practicing in Burlington who works diligently to reduce those barriers. Dr. Jacqueline Burrell is a primary care physician with Avalon Natural Medicine. She's often the first point of contact for patients who need to get mammograms. Dr. Burrell, welcome.
Hi, thank you so much for having me.
Now, Dr. Burrell, first, could you tell us a little bit about being a naturopathic doctor? What does that mean, and how might it be different from a doctor that somebody might come across in another space, in a hospital, for example?
Absolutely. I get this question all the time. So I'm a naturopathic physician. We're a pretty distinct healthcare profession where we combine the wisdom of nature with the rigors of modern science. So we are trained as primary care physicians who diagnose, treat, and manage patients with acute or chronic conditions, while tending to look at disease and dysfunction at the level of your body, your mind, your spirit. So our appointments are often a little bit slower, a little bit more in depth, which I love in primary care, really getting to know my patient and understanding who they are to better provide the different treatment options that might be available. So essentially, we're primary care providers. Some of us have different specialties. And in Vermont, we've got a great scope of practice to be able to do everything from referrals to different specialists, ordering all of these screenings, and going from there.
And you are often the first point of contact, as you're saying, for people to get early screenings, such as mammograms. Could you talk us through a little bit what that process might be like, from maybe meeting a patient for the first time and then referring them on to get something like a mammogram?
Right. So, these screening guidelines do change sometimes. And in primary care, as many of you probably know, you go in, you get your annual physical, and your provider should sort of talk you through the most updated screenings. And here, if I have somebody come in for their annual physical, I'm like, all right, it's time for your, colonoscopy time, or I'll talk them through which screenings are recommended. And take the time to really go through their questions. Anxieties are completely common and normal. As there's often different screening recommendations. So going over what is the best practice and going from there. So again, it's really a lot about that conversation between physician and patient and making sure that there's real good understanding so folks can know what is best for them at that time for prevention.
Well, let's talk a bit more about that understanding. What you're saying right now, Dr. Burrell, reminds me of an email that we got ahead of today's show from a listener named Jessica, who wrote to us and said, I have switched to only getting a mammogram every other year and am considering not having one at all. There's a growing number of medical scientists that say that smashing your tissue into a pancake and then radiating it throughout is not good. There needs to be a different way to detect a mass. They go on to say that this is a huge money-making machine for hospitals, and we must always question where there is money to be made and who is going to actually benefit the most. That's, again, from a listener named Jessica. I wonder what you would say to somebody like Jessica, who's feeling what appears to be some real deep concern about why physicians are recommending mammograms and concerns about maybe like some profit that are going on in this process.
Yes, mistrust is so common, and it's understandably why. So this is kind of a two-pronged answer. One being, I like to do prevention. I'm a naturopathic physician. Prevention is like the base of everything I do. So most new breast cancer cases are diagnosed at that localized stage, which means that they've not gone outside of the breast. And these early stage cancers are most found during these breast cancer screenings and typically have a high rate of survival because treatment is more effective at this stage. And one of the reasons why screening recommendations are now at age 40 is particularly because of the way that breast cancer affects different groups like BIPOC groups, Black women in particular, at an earlier age. So in order to treat these cancers that are treatable at that stage, regular early screenings are recommended in order to prevent a bigger issue down the road. But that is not to discount or minimize the impact of that historical mistrust of the healthcare system. And that comes from many different backgrounds. Me as a BIPOC physician myself, I definitely learned this through school, learned this in my background as a sociology major at UVM. Health inequality and inequity is complex. It operates at multiple levels, from personal biases to systemic problems in healthcare organizations. The list definitely goes on. So understanding, all right, this is what the reality is. This is what the amazing modern science has. How can we integrate that with a true understanding of why do people mistrust the medical system? And how can we bridge those gaps to prevent disease that is preventable?
We also received an email from a listener named Paulette in Braintree, who told us a story about her daughter-in-law who felt something strange in her right breast, scheduled a mammogram, was told she was fine, asked to have an ultrasound. Ultrasound also showed nothing. And then eventually got an MRI, and sure enough, there were early stages of breast cancer in her right breast. Paulette says that her daughter-in-law has had a double mastectomy and is now doing great. But the message here, Paulette writes, is that you must advocate for yourself strongly if you feel something is not right. And you may have to be very insistent in order to get the help that you need. Does that track with what you've experienced in the medical establishment, Dr. Burrell?
Advocacy is definitely important. Self-advocacy, unfortunately, is more of a trend than I would like it to be. A lot of folks have not been always felt heard in appointments, or maybe don't feel like they're getting their concerns across. So I always encourage patients to, tell me what's going on. You know your body best. I'm just here to help guide you to the place that can help get you treatment you might need. So although I can't speak to that particular medical case, I do understand that sometimes folks feel like they really have to push for treatment that they get that gut feeling for. I always tell folks to trust themselves. You know your body best. And, I wish, and I think there is a growth for more patient-centered care. That's the trend that I'd like to see go more in the future.
Now, ahead of today's show, we've also heard anecdotally, as I'm sure many of our listeners have, about the shortage of not just medical providers generally across the state, but specifically about BIPOC primary care physicians in Vermont and BIPOC medical providers of all types. I'm curious if you've witnessed or experienced that shortage yourself and how it affects your own practice.
Absolutely. So, in Vermont, we already know that we're not the most diverse state. I'll just say that.
Yeah.
And I learned this when I started here. I went to UVM, lived here in Burlington. I left to do school in California. And then when I moved back, it really was important for me to be that primary care physician I never had. I never was able to go to someone that looked like me to discuss my concerns, have culturally competent care, and just feel safe, building that trust. So that has been one of my goals as I'm building my life here in Vermont, to create a place or a community or a dialogue to make folks that of different variety of backgrounds feel comfortable going to someone. And it truly is a privilege to see a primary care physician that looks like you. And it's something that I hope to, expand for folks. This summer, I'll be opening up my own practice in Burlington, and I'm just so excited to be able to be one of the few, BIPOC providers that has their practice in Burlington and expand that network. It's truly something that is vastly different in other parts of the country. So, we're catching up.
When you say culturally competent care, what does that mean?
So that, it is a broader term, but for me, I like to blend that sociology and that medical knowledge together. So understanding that historical mistrust of the healthcare system, especially for communities of colors, for BIPOC communities, for communities of lower socioeconomic status, transgender communities, there's a lot of true mistrust, and it makes sense due to different historical events. There's implicit bias. Implicit bias includes unconscious prejudice, stereotyping in the healthcare setting. There was a pretty famous 2016 survey of medical students that found that a substantial number of them believed that Black people felt less pain than white people. And this explains why Black Americans tend to be undertreated for pain. And that's not just in the US, this is definitely something worldwide, but understanding these things, and this might explain why someone is less comfortable talking to you about these sensitive issues, talking about breast health, sexual health, hormonal health. These are all sensitive topics, and really working to build that therapeutic relationship between a patient and the physician, vice versa, is key. Having trusting your provider, so that way we're not missing these things that are preventable.
We received an email just now from a listener named Aviv who writes, "My question is, my mom has always been told she has extremely dense breast tissue, and for the past decade, her doctors always ordered both a mammogram and an ultrasound as routine. I just got my first mammogram last year at age 40, and my tissue also came back as extremely dense. Can I request both a mammogram and an ultrasound as a routine screening?" Dr. Burrell, I'm curious if you know the answer to this one.
Yeah, so I'll kind of just go over the general recommendations. I always recommend go talk to your doctor, to your OBGYN, your primary care provider. Talk through it with them. Everyone's going to be different. Every case is different. In general, again, we're going off of several different screening guidelines. Regardless of race, women, age 40 above, recommended age to start annual or biannual breast screenings. If you've got that genetic risk, for example, if your mother or grandmother had breast cancer, it's recommended that annual breast screenings begin at age 30 or 10 years earlier than the age of that first diagnosable breast cancer case. Some folks do get these secondary screenings after they already have had breast tissue that's too dense to fully see on a mammogram. So my recommendation is to, again, build that relationship with your doctor and ask them, am I the candidate to get these extra screenings? These recommendations do change. But again, you need to talk to your primary care provider about it, or your OBGYN to really get that specific advice for your specific case.
And speaking of advice, I'm curious what your advice is for somebody living in Vermont who is perhaps a BIPOC Vermonter who is seeking similarly a BIPOC provider and is really struggling to find that person. I imagine that you've had a number of patients come through your door who have looked for a while to find somebody that they can develop that relationship with in that way that you've described. What is your advice for somebody who's seeking that right now?
You know, in Vermont, the BIPOC community has got a great sort of word of mouth system. In fact, a lot of different communities in Vermont do. We're a small state. You know, I see patients from all over the state that come into Burlington, do telehealth, things like that. So ask around, ask friends, ask your communities who you're going to see. It is a truly astonishingly small amount of BIPOC providers. I'll just start with that. So it is difficult and that is unfortunate, but the best we can do is really help each other network and find that person that's the best fit for you.
Well, let's take one call here before we have to take one more break. Ray in Montgomery is on the line. Ray, you're on the air. Go ahead.
Hi. It sounded like this conversation was open to screening for men, maybe too. And I just wanted to emphasize getting prostate digital exams and regular PSA tests when you get to a certain age. When I was still working, I had a flight surgeon doing 6-month medicals, and she always insisted on a digital prostate exam. I mean, it's sort of a gross topic, but she probably saved lives. So I've continued that every year, getting a baseline PSA test and a digital prostate exam from a urologist. So something to think about, guys, and I'll take the answer off the air.
Oh, thank you for the call, Ray, and for waving that flag as well. And yes, we've mostly been talking during this show about breast cancer screenings and mammography. And of course, men and non-binary people can get breast cancer as well. And Dr. Burrell, I'm curious if you've seen this language around breast cancer screenings change during your time in medicine to make it more inclusive.
Absolutely. And this definitely happened, obviously more recently as we've kind of caught up to the times, I'll say. So although there's lots of different recommendation guidelines, and it is recommended that screening mammography be performed every 2 years at the age of 50, and 5 to 10 years of feminizing hormone use criteria have been met. So still doing screening recommendations for non-binary folks. It's definitely important to continue the screenings and to go to the caller's topic. There's lots of different preventative screenings that are important to have. And again, have that conversation with your primary care provider. According to the American College of Radiology, they recommend if you're assigned female at birth, non-binary, trans men, and you've had top surgery, so you don't have any breast tissue, no testing is recommended. Again, that will change depending on your genetic history. So again, these are conversations that are absolutely best had one-on-one. It's good to have a general idea of these different screenings, to be inclusive in language, inclusive in sensitivity, doing appropriate physical exams in the office. All of these are key, but again, that building that trust, that relationship with primary care and their patient is, I think, one of the key ways, and OBG urology, key ways to get these screenings taken care of and discussed so you can talk through these concerns.
Well, Jacqueline Burrell, a naturopathic primary care physician with Avalon Natural Medicine in Burlington, thank you so much for talking with us today and for help getting this information out into the world and hopefully building some of these connections too. Thank you.
Thank you.
If you're just joining us, today we are talking about mammograms, why they're important, and the barriers to getting one. Cost, both real and perceived, can be one of those barriers. There's a program run by Vermont's Department of Health that can help cover the cost of breast and cervical cancer screenings. It's called You First. Our next guest is a patient navigator with You First, Melissa Doan. Melissa, thank you so much for joining us.
Hi, thanks for having me.
Now, You First, as I understand it, it isn't an insurance company, but it does help people navigate screenings and pay for them. Tell us more about how it works.
Yeah, you're right. We're not exactly an insurance company, but there are lots of different parts of our program, and in the sense of paying, we do function like an insurance company. For those who qualify, they get a membership card that has billing information on it. They take it to their eligible appointments, and the provider then bills us for those services.
And how long has this program been around?
The funding started from a grant. The laws were passed for the grant back in 1990, and funding all started in 91. Every state and territory and a lot of tribal communities in the U.S. all have funding for a version of this program. Every state runs it a little bit differently. They all have different names, but in Vermont, it's called the You First program.
And tell us a bit more about who qualifies.
Well, first of all, they have to live in the state of Vermont. Citizenship is not a concern for us. They just have to reside in Vermont. And income-wise, they need to be at or below 250% of federal poverty level, which I know is pretty vague. To give an example of that, for a household of one, that would be $3,138 a month. And if you go on our website, you just search You First Vermont, the whole chart of eligibility where you can look at weekly, monthly, or annual income for different household sizes is all right there and easy to find.
And how many people are using this program today in 2024?
I forgot to double check our most recent numbers, but I think we're only at about 600. And there's a lot more people in the state of Vermont who are eligible, who maybe just don't know about this program. But we can help people who have no insurance. Also, people can have insurance. It's really beneficial for people who have high deductible plans and big copays and cost shares. And we can actually pay those costs for eligible services as well.
Well, if you have questions about the You First program, how it works, or how it can help you access certain types of health screenings like mammograms, give us a call. Our number is 800-639-2211. Now, you just touched on this a bit, Melissa, but today we're talking in large part about some of these barriers, both real and perceived, deeply felt barriers that exist in getting a person who needs a mammogram or a similar screening into that appointment. What are some of the barriers that you've learned about in getting Vermonters preventative care?
Cost is definitely a huge factor, and that, for those who qualify, that's a really easy to solve one for us. Knowledge is huge. Not everybody knows what screenings they should be having, how often they should be getting them, why they need them, or even how to go about that. We help people with finding providers so that they can get those referrals. Some people need help in making appointments. Some people just really need to hear specifically about what that process is like. And I'm so happy that this story has happened too, because this will be a great tool to point people towards, as well as us describing procedures to people. But transportation can be a barrier as well, and we do provide transportation to appointments. Fear is something that we come across often. Sometimes for people who have a close, friend or family member who's gone through cancer, it can make them more vigilant and they really want to get those screenings done. But it also, for some people, can make them very fearful and not want to do it for fear of finding out they too may have a cancer diagnosis. Cultural reasons can be another big one. Not every culture is big on preventative medicine. In a lot of cultures, you would really only go to a doctor if you were sick. So just presenting the idea of what preventative screenings can do is something that we can help people with as well.
And to return to the issue of cost, I saw ahead of today's show a recent study from radiology that found that 1 in 5 patients that were surveyed said they would not go in for recommended follow-up imaging if they had to pay a deductible, which is rather, kind of stops you in your tracks to hear how many people are not able to go get the services that they need because of a deductible or another type of cost that's in the way.
Yes, that insurance companies now, and if you have Medicaid will pay for all of it no matter what. But if you have like a Blue Cross Blue Shield or MVP, for example, primary insurance, those insurance companies have to pay your annual screening mammogram. That's part of that preventative care cost. But if you need what's called a diagnostic mammogram, which is, if you have symptoms, pain or a lump or something, or if something was seen on that first image, or you need an ultrasound or MRI, those are all subject to your deductible, and it does prevent people from going in. And that's where you first can help for those who qualify, that we can pay that cost. And we sometimes come across people who apply and they're not eligible, and we do our best to find other resources and help them figure out financial assistance and other programs that might help them.
Oh, I'm speaking of these barriers too. I know that we have heard about this backlog in being able to get a mammogram appointment that really became more intense during the pandemic. From your seat, Melissa, do you still hear about these types of backlogs and getting people appointments? So even if you remove the barriers of cost and other issues we've discussed today.
We do. The mammograms themselves seem to, at least, like you said, from my seat, have settled down a little bit. Just since COVID, there were a lot of backlogs. It's catching up. Some of the hospitals do always have a few months long wait for screening. Again, that's different, though, than if somebody has a symptom and needs to be seen sooner. Those are different slots that do have a shorter wait time. The bigger barrier we're running into right now is access to primary care or GYN care in order to get the referral. Most hospitals will require a referral, but even those that don't, you still need a doctor's name attached to that test because they need a place to send that report to. So if somebody doesn't have a doctor, it can become a barrier. So we do see that quite often in Vermont right now.
And Melissa, remind us again, how can people sign up for you first or learn more about the program?
If you go on the internet and search You First Vermont, it's the very first thing that will come up, and there's a lot of information on there. You can email us from there, and you can also call us at 1-800-508-2222.
And we will be sure to include links to this program and the other ones that we have discussed on today's program on vermontpublic.org under the Vermont edition show notes today. Melissa Doan is a patient navigator with Vermont Health Department's program, You First. It helps cover the costs of breast and cervical cancer screenings, among other programs. Melissa, thank you so much for joining us.
Thank you for having me.